Hi everyone! In today's video, we are going to be talking about what exactly akathisia is. Welcome back to the channel. If you're new here, my name is Lauren and I make videos about what it's like living with schizoaffective disorder or schizophrenia. If you would like to learn more from this channel, make sure to subscribe. Also, if you are interested in helping us to keep creating this kind of content, please consider checking out our Patreon page. The link is in the description below. Once you become a patron, you'll also gain access to our private Discord server where we offer a supportive community and also run weekly online peer support groups. If this interests you at all, please check out our Patreon page. Alright, so akathisia is usually a side effect of antipsychotic drugs. It is a movement disorder that makes it hard to stay still and causes kind of an urge to move that you can't really control. So I have experienced akathisia quite a number of times and it is truly dreadful. The way I describe it is by equating it somewhat to the feeling you get if you've kind of, drank way too much coffee. A friend of mine calls this sensation the feeling of doom, and that is absolutely what akathisia feels like. Doom. Basically, what it can feel like is just kind of wanting to just jump out of your skin. You may need to fidget all the time, walk around, or do things like crossing and uncrossing your legs. It is possible for other drugs to bring on akathisia as well. These can include drugs to prevent vomiting and nausea, some antidepressants, and calcium channel blockers. Certain health conditions can also bring it on, such as Parkinson's disease, traumatic brain injury, or encephalitis, which is a type of brain inflammation. So doctors aren't quite sure why exactly these drugs cause this effect. A theory, though, is that these medications block dopamine, which plays an important role in muscle control. So diving more into the symptoms of akathisia, the main sign of it is just kind of a general sense of restlessness, or what I call the sense of doom, and an intense need to just move around. In order to relieve this feeling, you kind of just need to stay in motion. So people with akathisia are likely to do things such as rocking back and forth, walking in place or pacing, and shifting their weight from foot to foot, crossing and uncrossing their legs, squirming or fidgeting, and sometimes even grunting or moaning. This inner restlessness can also cause feelings of irritability, stress, impatience, or panic. And again, the most apt description I can think of is just feeling like you just need to jump out of your skin. It's important to note that not everyone taking an antipsychotic medication gets akathisia. Symptoms usually start within a few days, and it is more common with first-generation antipsychotics, but it can still happen with newer antipsychotics too. It can also be more likely to occur if you start right off on a higher dose, increase doses drastically and suddenly, or if you stop medication suddenly without tapering. So there are 4 different types of akathisia depending on when you get the condition. So the first one is acute akathisia, and it develops soon after starting a medication and lasts for anywhere less than 6 months. The second one is chronic akathisia, when it lasts for more than 6 months. The third one is tardive akathisia, which is when it develops months or years after starting a medication. And the fourth one is withdrawal akathisia, which typically sets in within 6 weeks after switching or stopping an antipsychotic medication. Treatment for akathisia is most commonly simply switching your medication. Your doctor may lower your dose or switch you to a medication that is less likely to cause akathisia. There are also medications that can be used to treat akathisia, including beta blockers like propranolol, which is usually the first treatment prescribed, which I have used in the past. Benzodiazepines, which are anti-anxiety medications used only for short-term use. I use these as needed. Anticholinergics, which are typically used for movement disorders such as muscle stiffness or certain kinds of tremors caused by antipsychotic medications. Certain antidepressants, which at low doses can help to relieve akathisia symptoms. Drugs for Parkinson's disease, which can help to boost your dopamine levels, potentially easing akathisia. And vitamin B6, which high doses of can help ease akathisia symptoms as well. If you have this inner sense of doom or inner restlessness as a result of medications, it is very important to let your doctor know. If left untreated, akathisia can lead to quite a bit of distress, disruptive behaviors, or sometimes even suicidal thoughts. Also, I just want to remind you to not stop taking your medications until you have consulted with your doctor and figured out a safe way to do so or some other alternative. It is possible for your doctor to adjust your dose or to change your medication to relieve your symptoms of akathisia. So the outlook for akathisia is fairly good. So typically once your doctor lowers your dose or finds the right medication, akathisia will go away. The only exception is tardive akathisia, which only affects a small number of people. The only way to prevent akathisia or to lower the risk of it is for your doctor to start you on a low dose of antipsychotic medication and then to gradually increase the dose over time until the right therapeutic dose is reached. So thank you so much for watching this video. I hope it was helpful in learning more about akathisia. I would love to hear about any experiences you've had with akathisia and how it's been managed, if it has, in the comments below. If you would like to see more videos from us like this one, make sure to subscribe. And also, if you would like to help support us in continuing to create educational content like this, please consider becoming a patron through our Patreon page. The link is in the description below. Thanks so much again for watching, and as always, wishing you and your loved ones good health. We'll see you in the next video. Bye.